Welcome to Startup Health Now. I'm Nicole Clark, Senior Writer at Startup Health, and today I'm pleased to share a message from Steve Krein, Startup Health CEO, co-founder and managing partner. It's a special message because of where it was delivered, from the iconic Sydney Opera House at the Sohn Hearts Minds conference in Australia. But it's also special because it offers a sort of bookend on 2019. This has been a big year for Startup Health's global army of health transformers. And in this message, Steve lays out the motivation that is driving Startup Health's mission to achieve 11 health moonshots by 2040. Steve was one of the global investment experts that Sohn invited to speak at their 4th annual conference. The Sohn Hearts Minds conference is Australia's premier investor event, and it works like this. In the span of a single day, global and local investment professionals take to the stage at the Sydney Opera House. They share their expertise and exclusive investment ideas in a fast-paced format. The conference is philanthropic. It offers a unique opportunity to raise funds for medical research in Australia while gaining insight from top investment minds. At this year's conference, for the first time in the 4-year history of the event, Ray Dalio, who founded the $160 billion macro hedge fund Bridgewater, and Howard Marks, the co-founder of the $122 billion Oaktree Capital firm, shared the same stage. And our very own Steve Krein kicked off the afternoon portion of programming at the event. So, without further ado, here's that special message Steve shared with the world from the stage at the Sohn Hearts Minds conference in November.
Good afternoon. I've always wanted a band to open up for me, so what an incredible honor to have Daryl in that incredibly moving moment where this community came together and sang songs. And I think that's a wonderful illustration of the power of community. And I was beyond honored 6 months ago when I get to meet Michael Walsh in New York and hear about the wonderful program and the innovative way that the Sohn Hearts and Mind Conference in Australia had a little unique twist. And this idea of investing in medical innovation and a community coming together to not just make money, but to make impact inspired me to take the trek down here and not just spend some time, but really get a sense of the mindset that exists in this wonderful country. I want to talk for a few minutes about what we've noticed over the last 8 years around the idea of how real meaningful impact can be made. And we call it the Health Moonshot Mindset. And it really goes back to a story from the 1960s where we recognize that something very unique, seemingly impossible, happened between 1961, 1962, and 1969, when an incredible mindset shift took place in the United States, but all around the world, as everyone saw the impossible as possible. So this idea that landing an American on the moon and bringing him safely back to Earth, nobody knew how it could be done. Nobody knew how the technology could even be possible to make that possible by the end of a decade. The funding wasn't there, the collaboration, the cooperation wasn't there, and yet over the next decade, from 1961 to 1969, it happened. And so everyone knows the story of the actual moon landing and that Neil Armstrong in this famous picture landed on the moon, but we thought about this as a great metaphor for thinking about how we can apply a lot of the same principles that the Americans used in the 60s to achieve what we call health moonshots. So it's a metaphor, but it's also a model that we've developed over the last 8 years and thought about really how we, like you're doing here at the Sohn Conference, can use community globally and locally to make real meaningful impact. And many people don't recognize the irony in the fact that Neil Armstrong landed on the moon, but the same year that JFK, John F. Kennedy, made the proclamation that we were going to do this, Neil's daughter was diagnosed with a brain tumor, and 2.5 months later, died of pneumonia. So this image of Neil Armstrong that everybody is so familiar with, they're not familiar with his family. And what they're not familiar with is the fact that no matter how much money you make, no matter who you know, no matter the access to technology or science, it doesn't matter. This is Bill Gates, whose mother passed away of breast cancer at 64, and his father is going through the stages of Alzheimer's disease. And yet, it's not just that it happens to him, it's that there's nothing he can do about it except invest and hope in siloed nature all around the world. And so we believe this is a moment in time, just like 1961, to proclaim that we need to work together, both locally and globally, as a community, as an army of entrepreneurs and innovators, of investors and organizations, to achieve 11 health moonshots. that just like landing on the moon in 1969 seemed impossible, as I walk through these moonshots with you, you might think the same thing. The idea of bringing access to care to everyone in the world, no matter how much money they make, no matter where they live, the idea of bringing cost to zero using technology to remove all of the unnecessary costs in the whole healthcare system or delivering access to care. The curing of disease, the ending of cancer, the idea that we can prioritize women's health and children's health, that we can actually look at nutrition and fitness as a way to wellness. The idea that there's mysteries of the brain that we don't understand, much like the Alzheimer's moonshot, that is a seemingly impossible goal today, but if we look at mental health and happiness, the suicide prevention, did my thing go off? Oh, there we go. Health and happiness and longevity, and finally the addiction moonshot, our latest moonshot, all designed to be inspiring signals of hope. So we've used these moonshots to create a new model inspired by the Apollo mission that looks at the Earth rather than the moon, that looks at the Earth as an opportunity for all of us to work together. And much like we saw earlier today, the flywheel of companies that succeed because they get the flywheel going and it keeps going, we believe the same thing needs to be applied to investing in health moonshots. The idea of providing capital every year, like the Sohn conference demonstrated when Guy went and showed you every year the increasing amount of capital being deployed, this is just the beginning. Imagine 20 years from now how much money this program can donate to medical research, to the health moonshots that are important to all of you. The idea of uniting everyone around these moonshots as a global army, linked arm in arm, so that they're not siloed by country, by region, by individual, by investor, but they're done as a global army working together. The idea of broadcasting the progress, the stories, much like in the 60s, the United States used television, a modern miracle at the time. We use digital and print media to tell the stories of the progress of these moonshots quarter after quarter, year after year, connecting everyone together, the angel investors, the VCs, the corporate VCs, the foundations, the payers, the providers, the pharmaceutical companies, and the governments working together as a collaborative effort with a mere idea of 1% of the amount of money dedicated to moonshots could actually, over a compounding nature over 10 or 20 years, help us achieve the sustainable development goals that the UN set out for 2030 or Health Moonshots by 2040. Over the last 7 years, we've made 300 investments using the Health Moonshot investing model in 24 countries, and this simple idea we created was designed to inspire and show everyone how little is needed. And much like the United States just committed 1% of their federal budget in 1961 to landing a man on the moon and bringing him safely back, we believe that individuals and organizations, much like you're doing here, can reach into their pocket and donate up to 1% of something meaningful to them. It could be an R&D budget. It could be a philanthropy budget. It could be just a small little token of something meaningful so you can signal to everyone what moonshot is important to you. So I want to actually use this moment to ask everyone to participate in a little bit of an individual moonshot challenge. And Peter Joseph from Black Dog gave me a little challenge that said, I want to see you do this up on stage because I think this is the signal and the symbol of this conference. The idea that a community of people can come together and every year be dedicated to achieving health moonshots. How many of you are committed to the access to care, the cost to zero, the cure disease, or the ending cancer moonshot? Please stand up. I don't even want you to raise your hand. Please stand up if any of those moonshots resonate with you. Now, what if I said women's health and children's health? I'd like to ask you to stand up as well. Nutrition and fitness, brain health and unlocking the mysteries of the brain, mental health and happiness, suicide prevention towards zero, longevity and addiction. Now look around the room and do something that, this is the challenge, I want you to link arms with the person to your left and to your right. Link arms and I want you to look around the room at the energy that took place when I said that. Think about this moment where we're linked arm in arm. These are not 800 individuals in this room. This is a community of people committed for the last 4 years and the next 20 years, or 30 years, or 40 years, to achieving your individual health moonshots, the global health moonshots, and recognize that connecting you to everything around the world that's working like you are to achieve and improve the impossible dream of improving the health and well-being of everyone in the world. We can do this together. I'm honored to be here. I'm excited about what you've done in 4 years. I can't wait to watch for the next couple of decades as you not only raise more money, but bring the energy and the community and the collaboration to shine a spotlight on Australia and the wonderful work that's done here, and I can't wait to collaborate with you. Thank you very much.